And now, please rise as we introduce the Upstate Medical University College of Health Professions graduates of the year 2012. The procession is led by Chief Faculty Marshal, Dr. Victoria McGee, followed by flag bearer Chikosi Oniana and graduates from the College of Health Professions. The faculty of the College of Health Professions are led by Faculty Marshals Dr. Janet Coy, Ms. Josephine Prespiora, and Mr. Kenneth Galbraith. The academic officers and honored guests include Dr. Hugh Bonner, Dean, College of Health Professions; Dr. Patricia Joy Newman, Distinguished Guest Speaker; Dr. David Smith, President, Upstate Medical University; Victoria McGee, Chief Marshal; Wanda Thompson, Associate Senior Vice President of Operations; Dr. Lynn Cleary, Vice President of Academic Affairs and College of Medicine Senior Associate Dean for Education; Julie White, Dean, Student Affairs; Dr. Julie Thurling, Graduate Student Speaker; Chikosi Oniana, Undergraduate Student Speaker; Antonino Benevuto, Poetry Reading; Joan O'Brien, Senior Associate Dean, College of Health Professions; Susan Graham, Associate Dean, College of Health Professions; David Clementi, President, College of Health Professions Alumni Association;
Ms. Monica Marona will now sing the national anthem. Please be seated. It gives me great pleasure and honor to present Dr. Hugh W. Bonner, Dean and Professor, College of Health Professions.
Good afternoon. Welcome to our celebration. This is the 39th graduation ceremonies that we have had for the College of Health Professions at Upstate Medical University. This year we have 188 graduates who will cross the stage. We've had baccalaureate, master's, and doctoral level. I would like, at this time, if I could, have the graduates of the class of 2012 please stand up and be recognized and remain standing. As they stand, Would the parents of the graduates please stand and be recognized? Keep standing, folks. Keep standing. Would the spouses and children of the graduates please stand up and be recognized? Will the grandparents of the graduates please stand up and be recognized? Just to top off the entire thing, let's all friends and relatives and family members please stand up. Those of you who have gone through any of our ceremonies know that our students are our reason for being. They are the reason we are here, and we make sure that we pay close attention to that. But the success of the College of Health Professions year after year is a responsibility of the faculty. The faculty are the heart and the soul of the College of Health Professions. And I would like for this faculty to please stand up and be recognized. The faculty are here now. They've been with you throughout your educational career, and they will be with you well into the future. Thank you very much. It gives me great pleasure and honor to introduce to you today the president of Upstate Medical University, Dr. David Smith.
Thank you, Dr. Bonner. Good afternoon. I as well want to add my congratulations to the families and all of those that have helped our incredible students achieve their goals here today. And of course to the graduates who have achieved remarkable things and will continue in the course of their careers and of course in the area of patient care, research, and even beyond. To all of them again, let's give them a big round of applause. On behalf of the faculty and staff of Upstate Medical University, I congratulate each and every one of you for your accomplishments for graduating today into the health professions. As students, you arrived here with a definite sense of purpose, and as graduates, you are leaving with our every expectation of success. In fact, our very health depends upon it. The best advice I can share comes perhaps from another famous doctor. He said, "Be who you are and say what you feel, because those who mind don't matter, and those who matter don't mind." Dr. Zeus. Students are at the very core of Upstate Medical University and our mission, and we are extremely proud of you. As you leave here as graduates, I hope you will be as proud of your university going forward, and stay connected. Your aspirations are now our aspirations. And there's one thing that we all have in common today besides celebrating your tremendous accomplishments. And that is, sooner or later, or already, every one of us will be a patient. We'll be lying there on that stretcher wearing that designer gown that doesn't quite cover everything. And you'll be looking up into the eyes and placing your heart, your soul, and your very being into the hands of these graduates. And as the president of this university, I'm here to attest to each and every one of you, I will be willing to do that because I know what they value, I know what they're capable of, and indeed we are all fortunate for this graduating class of the College of Health Professions of 2012. Congratulations.
The degrees from the College of Health Professions will now be conferred by President Smith. Dr. Hugh Bonner, Dean of the College of Health Professions, will present the recipients of the degrees in the College of Health Professions.
President Smith, as Dean of the College of Health Professions, I have the honor to present the recipients of the degrees Bachelor of Science and Bachelor of Professional Studies. With the completion of the curricula, they will have satisfied the requirements established by and have been recommended by the faculty for the conferring of this degree.
Thank you, Dean Barner. Will all the candidates for the Bachelor of Science and the Bachelor of Professional Studies degrees in the College of Health Professions please rise? You can applaud. By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon you the degree Bachelor of Science or Bachelor of Professional Studies with all its rights, privileges, and obligations herein. Congratulations.
Please be
Be
seated.
seated.
President Smith, as Dean of the College of Health Professions, I have the honor to present the recipients of the degree Master of Science. With the completion of the curricula, they will have satisfied the requirements established by the faculty and have been recommended by the faculty for the conferring of this degree.
Thank you, Dean Bonner. Will all the candidates for the Master of Science degree in the College of Health Professions please rise? By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon you the degree Master of Science with all rights, privileges, and obligations herein. Congratulations. You may be seated.
Dr. Smith, as Dean of the College of Health Professions, I have the honor to present the recipients of the degree Doctor of Physical Therapy. With the completion of the curricula, they will have satisfied the requirements established by the faculty and have been recommended by the faculty for conferring of this degree.
Thank you, Dean Bonner. Will all the candidates for the Doctor of Physical Therapy degree in the College of Health Professions please rise? By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon you the degree Doctor of Physical Therapy, with all of its rights, privileges, and obligations therein. Congratulations. You may be seated.
Those undergraduates receiving academic honors have met the following grade point criteria. Summa cum laude, 3.9 to 4.0. Magna cum laude, 3.75 to 3.899. Cum laude, 3.6 to 3.749. Graduate students receiving academic honors have met the following grade point criteria. High honors, 3.9 to 4.0. Honors, 3.8 to 3.899. Post-professional Doctor of Physical Therapy graduates are not eligible for those honors. Will all Bachelor of Science and Bachelor of Professional Studies graduates please come forward for induction to the College of Health Professions Alumni Association and to receive your alumni pin. Mayapem Arna Chalom, Bachelor of Science, Cardiovascular Perfusion. Javad Aswani, Bachelor of Science, Cardiovascular Perfusion, cum laude. Nathan Darrow, Bachelor of Science, Cardiovascular Perfusion. Laura DiCoco, Bachelor of Science, Cardiovascular Perfusion. Tyler Kelting, Bachelor of Science, Cardiovascular Perfusion, cum laude. Greg McLean, Bachelor of Science, Cardiovascular Perfusion. R. Scott Thompson, Bachelor of Science, Cardiovascular Perfusion. Heather Blaylock, Bachelor of Science, Clinical Laboratory Science. Kathleen Brown, Bachelor of Science, Clinical Laboratory Science, summa cum laude. Moveed Shohan, Bachelor of Science, Clinical Laboratory Science. Sarah Goodman, Bachelor of Science, Clinical Laboratory Science, magna cum laude. Teresa Haven, Bachelor of Science, Clinical Laboratory Science, summa cum laude. Ben Johnson, Bachelor of Science, Clinical Laboratory Science. Van Lee, Bachelor of Science, Clinical Laboratory Science. Brady Nesbitt, Bachelor of Science, Clinical Laboratory Science, magna cum laude. Chikozi Oniana, Bachelor of Science, Clinical Laboratory Science. Jarrett Pendle, Bachelor of Science, Clinical Laboratory Science, magna cum laude. Sarah Fluff, Bachelor of Science, Clinical Laboratory Science, magna cum laude. Benjamin Robity, Bachelor of Science, Clinical Laboratory Science, magna cum laude. Kristen Swick, Bachelor of Science, Clinical Laboratory Science, cum laude. Amanda Taylor, Bachelor of Science, Clinical Laboratory Science, cum laude. Brittany Thomas, Bachelor of Science, Clinical Laboratory Science, summa cum laude. Joseph Boko, Bachelor of Science, Clinical Laboratory Science. Madeline Zoko, Bachelor of Science, Clinical Laboratory Science, magna cum laude. Megan Zoko, Bachelor of Science, Clinical Laboratory Science. Ariel Antonucci, Bachelor of Science, Medical Imaging, magna cum laude. Leah Dan, Bachelor of Science, Medical Imaging, summa cum laude. Linda Dean, Bachelor's of Professional Studies, Medical Imaging, summa cum laude. Rebecca Diederich, Bachelor of Science, Medical Imaging, summa cum laude. Kimberly Donovan, Bachelor of Science, Medical Imaging, magna cum laude. Amanda Evans, Bachelor of Science, Medical Imaging, cum laude. Jamie Fabry, Bachelor of Science, Medical Imaging, cum laude. John Finetti, Bachelor of Science, Medical Imaging, summa cum laude. Owen Gahuli, Bachelor of Science, Medical Imaging, magna cum laude. Rebecca Green, Bachelor of Science, Medical Imaging. Emily Jarecki, Bachelor of Professional Studies, Medical Imaging, magna cum laude. Jason Jones, Bachelor of Professional Studies, Medical Imaging. Tina Kilgrove, Bachelor of Science, Medical Imaging, magna cum laude. Renee Cacello, Bachelor of Science, Medical Imaging, cum laude. Veneman Marchuk, Bachelor of Professional Studies, Medical Imaging, summa cum laude. John Marsh, Bachelor of Science, Medical Imaging, magna cum laude. Mara Modi, Bachelor of Science, Medical Imaging, summa cum laude. Lonnie Oakes, Bachelor of Science, Medical Imaging. Jairo Jose Orozco, Bachelor of Science, Medical Imaging, magna cum laude. Joanna Parrott, Bachelor of Professional Studies, Medical Imaging, summa cum laude. Robert Ratliff, Bachelor of Science, Medical Imaging, summa cum laude. Michael Roberts, Bachelor of Science, Medical Imaging, cum laude. Katie Rospindowski, Bachelor of Science, Medical Imaging, summa cum laude. Marcus Ryan, Bachelor of Professional Studies, Medical Imaging, magna cum laude. Savannah Sicilo, Bachelor of Science, Medical Imaging, cum laude. Megan Southard, Bachelor of Science, Medical Imaging, magna cum laude. Nadia Totari, Bachelor of Science, Medical Imaging, cum laude. Gourmet Weljagoras, Bachelor of Science, Medical Imaging. Timothy Broderick, Bachelor of Science, Radiation Therapy, cum laude. Mary Coakley, Bachelor of Science, Radiation Therapy, magna cum laude. Lisa Field, Bachelor of Science, Radiation Therapy, summa cum laude. Renee Gardner, Bachelor of Science, Radiation Therapy, cum laude. Christopher Hills, Bachelor of Science, Radiation Therapy. Matthew Kaplan, Bachelor of Science, Radiation Therapy. Derek Kurtz, Bachelor of Science, Radiation Therapy, cum laude. Mark Levy, Bachelor of Science, Radiation Therapy, summa cum laude. Maggie Muchler, Bachelor of Science, Radiation Therapy, magna cum laude. Eve Palick, Bachelor of Science, Radiation Therapy, cum laude. Jenny Rapoli, Bachelor of Science, Radiation Therapy, summa cum laude. Rachel Warwick, Bachelor of Science, Radiation Therapy, cum laude. Kristen Welch, Bachelor of Professional Studies, Radiation Therapy, cum laude. Barbara Uhas, Bachelor of Science, Radiation Therapy. Amos Ajay Mensah, Bachelor of Science, Respiratory Therapy. Nazneen Akhtar, Bachelor of Science, Respiratory Therapy, magna cum laude. Antonita Benevuto, Bachelor of Science, Respiratory Therapy. Brandon Boyer, Bachelor of Science, Respiratory Therapy, cum laude. Stephanie Canali, Bachelor of Science, Respiratory Therapy, magna cum laude. Joseph Colello, Bachelor of Science, Respiratory Therapy. Heather Corbett, Bachelor of Science, Respiratory Therapy. Alexis Dunford, Bachelor of Science, Respiratory Therapy. Angie Ramirez Estella, Bachelor of Science, Respiratory Therapy. Astrad Henry, Bachelor of Science, Respiratory Therapy, magna cum laude. Jill Leet, Bachelor of Science, Respiratory Therapy. Catherine Navarro, Bachelor of Science, Respiratory Therapy. Kafai Ananuga, Bachelor of Science, Respiratory Therapy. Dina Pena, Bachelor of Science, Respiratory Therapy. Jennifer Reese, Bachelor of Science, Respiratory Therapy, summa cum laude. Jordan Sawyer, Bachelor of Science, Respiratory Therapy. Ann Schaaf, Bachelor of Science, Respiratory Therapy, summa cum laude. Joshua Smith, Bachelor of Science, Respiratory Therapy, magna cum laude. Karen Swinton, Bachelor of Science, Respiratory Therapy. Krista Yeti, Bachelor of Science, Respiratory Therapy. Will all Master of Science in Medical Technology graduates please come forward to be hooded and to receive your College of Health Professions Alumni Association pin. Sarah Height, Master of Science, Clinical Laboratory Science, high honors. Master of Science in Physician Assistant Study graduates, please come forward to be hooded and to receive your College of Health Professions Alumni Association pin. Hannah Burke, Master of Science, Physician Assistant Studies, high honors. Chad DeMarch, Master of Science, Physician Assistant Studies. Trevor Farnsworth, Master of Science, Physician Assistant Studies, high honors. Allison Ferris, Master of Science, Physician Assistant Studies. Alicia Gary, Master of Science, Physician Assistant Studies, high honors. Sarah Hand, Master of Science, Physician Assistant Studies, high honors. Arthur Hagi, Master of Science, Physician Assistant Studies. Christopher Jones, Master of Science, Physician Assistant Studies. Olivia Kenya, Master of Science, Physician Assistant Studies. Marina Morrow, Master of Science, Physician Assistant Studies. Susan Moak, Master of Science, Physician Assistant Studies, high honors. Kelly Reynolds, Master of Science, Physician Assistant Studies, high honors. Patrick Shannon, Master of Science, Physician Assistant Studies, high honors. Najada Smythe, Master of Science, Physician Assistant Studies. Ryan Stedwell, Master of Science, Physician Assistant Studies. Dishank Thakkar, Master of Science, Physician Assistant Studies. Kristen Wright, Master of Science, Physician Assistant Studies, high honors. Will all Doctor of Physical Therapy graduates please come forward to be hooded and to receive your College of Health Professions Alumni Association pin. Dr. Donna Elbert, Doctorate of Physical Therapy. Dr. Stephen Avalon, Doctor of Physical Therapy. Dr. Marina Bartonchek, Doctor of Physical Therapy. Dr. Brendan Boucher, Doctor of Physical Therapy. Dr. Holly Bundy, Doctor of Physical Therapy. Dr. Brittany Burr, Doctor of Physical Therapy, Honors. Dr. Brian Campbell, Doctor of Physical Therapy. Dr. Justin Charlin, Doctorate of Physical Therapy. Dr. Elvin DK, Doctor of Physical Therapy. Dr. Natalia Phillip, Doctor of Physical Therapy. Dr. David Hawley, Doctorate of Physical Therapy. Dr. Stacy Hyde, Doctor of Physical Therapy. Dr. Deborah Jakes, Doctor of Physical Therapy. Dr. Mia Lanks, Doctor of Physical Therapy, Honors. Dr. Jonathan Lee, Doctor of Physical Therapy. Dr. Andrea Legg, Doctor of Physical Therapy. Dr. Lauren Longo, Doctor of Physical Therapy. Dr. Amanda Lucas, Doctor of Physical Therapy. Dr. Julio Malonga, Doctor of Physical Therapy. Dr. Maureen Mancuso, Doctor, Physical Therapy. Dr. Julie Thuring, Doctor, Physical Therapy, Honors. Dr. Sean Monahan, Doctor of Physical Therapy, Honors. Dr. Stephanie Monroe, Doctor of Physical Therapy, High Honors. Dr. Drew Nelson, Doctor of Physical Therapy. Dr. Supriya Prince, Doctor of Physical Therapy, High Honors. Dr. Jessica Roberts, Doctor of Physical Therapy. Dr. Jael Schafler, Doctor of Physical Therapy, Honors. Dr. Jessica Cerrone, Doctor of Physical Therapy. Dr. Jessica Spingler, Doctor of Physical Therapy. Dr. Caitlin Steves, Doctor of Physical Therapy. Dr. Megan Turley, Doctor of Physical Therapy. Dr. Christina Chalupnicki, Doctor of Physical Therapy. Dr. Floridel Clark, Doctor of Physical Therapy. Dr. Shirisha Mandati, Doctor of Physical Therapy. Dr. Jose Polo Traverso, Doctor of Physical Therapy. The oath of the health professions, which is printed in your program, will be administered to the graduates in the College of Health Professions by Dr. Dean Bonner. Will the graduates of the College of Health Professions please rise?
Ladies and gentlemen, if you would, read after me. In the presence of my colleagues, family, friends, and teachers, I proudly make this solemn vow. I will give to my teachers the respect and gratitude that is their due, and share my knowledge with those who follow me. I will conduct myself with professional integrity, placing service to others before personal gains. I will treat all my patients with empathy, being sensitive to their beliefs, values, and background, providing care equally in quality and compassion. I will honor the privacy of those seeking my help, using their health care information and that which they reveal in confidence solely to support their treatment. I will continuously strive to learn from the advancements in my field, embracing new techniques and technologies that will improve my patients' experience. I will recognize that each patient's care is provided by a team of professionals, and my responsibility to my patient and my colleagues is to uniformly honor this pledge without fail for the betterment of the patient and my profession. This I do swear freely and upon my honor, as I commit myself to the service through my profession. Thank you very much, and sit down, please. That concludes the graduation ceremonies, and now we go into the commencement, and we will have the honors ceremony. Before we start that, everybody's been sitting for a while. Please stand up, stretch, and then we can focus a bit. Stand up, graduates. Thank you very much, and I think we will proceed. I ask that David Clemente, President of the College of Health Professions Alumni Association, will you please come forward and talk to our graduates about their alumni association. Good afternoon.
Well, first of all, on behalf of the Alumni Association and myself, I want to wish you all just a most sincere congratulations and job well done. Some time ago, you were all inspired to pursue a career in healthcare, a career dedicated to the service of others. And so you began your journey. You impressed your future professors at your interview, and you were selected to pursue your profession. And throughout the weeks and months of each semester, you've worked really hard. You've attended classes, practiced in labs, endured late nights of study for exams. You wrote a lot of papers, you gave presentations, and you honed your professional skills in many clinical sites around the state and beyond. Night after night, week after week, you've traveled all the solitary pathways and back roads on this challenging journey. And today marks the culmination of that journey. You are now entering the on-ramp of the expressway to your new and exciting career as a health professional. This has been one of the most important journeys of your life, and you've arrived. Well done. So now, as you segue from student to healthcare professional, the College of Health Professions Alumni Association welcomes you as its newest members. Some of you received Alumni Association scholarships. The association will continue to support you by keeping you connected to your fellow alums and to your alma mater in the years to come. As you cross the stage today, you received an Alumni Association pin. As you wear it, let it be a reminder to you of your days here at SUNY Upstate and the awesome opportunities that this experience has made available to you. And down the road, when the Alumni Association contacts you, please think of those doors of opportunity that have been open to you here at SUNY Upstate. And please support your Alumni Association in their quest to open those doors of opportunity to others as well. So now, as you emerge onto the highway of your new profession, do so confidently, knowing that you are committed to the health and well-being of humankind. We in the Alumni Association, and all of us here at Upstate, are extremely proud of you and all of your accomplishments, and we're very happy for you. We wish you all the best. Again, congratulations. Thank you.
It is my pleasure to introduce Antonia Benvenuto, who is a student, a graduate today from our respiratory care program. Ms. Benvenuto has a very skilled level of poetry, and she has written a number of poems, and it came to my attention that she had written one about the class of 2012, and I asked if she would please come and read for us. Antonina.
Good afternoon. My name is Antonina, and I would like to give a special thanks to Dean Bonner for allowing me to come up and share this poem with you today. Also, a special thanks to our professors, classmates, family, and friends for believing in all of us and being so wonderful through this. I would like to dedicate this poem to the 2012 College of Health Professions class, and also to my grandmother, Marian Benvenuto. Now for my poem. We are bypasses and ventilators. We are lab work and much more. Ingrained in our brains till our frontals were sore. We are radiation and physical healers. We are the therapeutic drugs. Saving patients' lives just to get their hugs. Tears and frustration, homework that never ends. I'm glad to have met the people I call friends. Hard work and success and knowledge that will pay. Congratulations, 2012 class. You deserve this special day.
Thank you very much. That was great. The students select the speakers for both the baccalaureate and the graduate level. The undergraduate speaker this year is Jagozi Aniana, who was the 2010 undergraduate speaker. And I'll ask Jagozi if you would please come forward.
Sorry, let me just get myself together. All right. Hello and welcome, everyone. I promise I'll keep this nice and short. The NBA playoffs are on, so that kind of takes priority. Well, my fellow graduates, the day has finally come where we can excel with great satisfaction and revel in our academic victories. I know all of you are just as elated as I am to reach the end of this treacherous but rewarding journey. Today is one of many hallmarks we will experience in our lives, and it will forever be emblazoned in our hearts and in our memories. We share this day with the three big F's: our lovely faculty, our friends, and our families. We thank the faculty for all their dedication and guidance. Your outstanding teaching ability has given us the tools needed to become the future leaders of tomorrow and reputable candidates for job placements nationwide. Surprisingly, we also want to thank you for the occasional mind-blowing exams and assignments, which at times placed us on the verge of tears. I know I was, but I know you meant well. To our friends and families, we thank you for allowing us to vent and tell you things we couldn't tell the faculty members. Let's just say some things are best kept a secret, so we thank you for keeping them. All of us came from different locations and different points in our lives. I'm sure some of us did not expect to establish a close bond with students on campus. Speaking from personal experience, I'm very fortunate to have developed great friendships with many of you. I would name all of you individually, but there are just too many of you, and you didn't pay me, so. Family comes in different shapes and forms, both traditional and non-traditional, and they are there from the beginning to the very end. Our families are the ones who have raised us to be the very best and to do the very best. Words cannot express the amount of gratitude we feel for all you've done to bring us to this vital juncture in our lives. Your unconditional love, direction, and protection are what made today possible. Since we're on the topic of thanking our families, I would like to take this time to thank mine, who have done the aforementioned and many more. To my wonderful parents, I just want to say I love you both very much, and I thank you for always being there for me. Without having you and my younger brothers to support me, I would absolutely be nothing. I actually want to do the unorthodox thing and thank all of our enemies and the naysayers. We all have them and may encounter many more in life. It's imperative to thank them for all the negativity and various attempts in trying to break our spirits. As funny as it sounds, this was one of the many factors that kept us on our toes and motivated us to prevail through life's challenges. They gave us the opportunity to demonstrate our resilience. Although they tried to hamper our ambition, they failed miserably. Because, my fellow graduates, we are here, we won. However, we can't be too complacent with this current victory, because the battle doesn't end here. As soon as we leave this building, we will all begin a new battle and journey. Many of us have already obtained jobs in our fields and are currently studying for boards, while others are furthering their education. Keep in mind that our enemies will continue to try, with emphasis on the term try, to pull us down. They will wait patiently for our downfalls, but they will never see it. The late and brilliant Steve Jobs summed it up nicely with this quote: "Your time is limited, so don't waste it living someone else's life. Don't let the noise of others' opinions drown out your own inner voice. And most important, have the courage to follow your heart and intuition. They somehow already know what you truly want to become. Everything else is secondary." So, my fellow graduates, we have to be resolute and strong. Be willing to remove the term intimidation from our vocabulary and never let anything stand in our way. And even if our enemies watch us stumble a little bit, listen to your heart's desire. Brush yourself off and keep going. Remember to always exercise humility and self-assurance. I'm very confident in our ability to do just that. The sky is the limit, and it will be our responsibility to decide how high we will fly. With the amount of potential stored in this room, I know we will soar well above the sky's limit. In fact, College of Health Professions Class of 2012, we're going to have to create our own galaxy because there's just no way to accommodate this quantity of greatness here on Earth. So much for humility. We'll start that tomorrow. I want this galaxy to be our refuge where we can encounter any obstacles or a place to celebrate when we garner more accolades down the road. I don't know the name of it yet, so bear with me. I do know that this galaxy and all our futures will be so bright, so luminescent, that we're gonna need some shades. So prepare for takeoff, my fellow graduates, and I'll meet you all there. Congratulations, class of 2012, and I wish you all the absolute best of luck. Thank you.
Well, as an aside, I went to the formal dance last year, and that dude can dance. It is my pleasure to introduce to you the speaker from the graduate programs. I am very happy to introduce to you Dr. Julie Thering, Doctor of Physical Therapy.
Said, it is better to keep your mouth closed and let people think you are a fool than to open it and remove all doubt. Well, it's a little too late. So, thanks to the nomination of my peers, I have the esteemed honor of delivering this speech, and you, my audience, have the esteemed duty of sitting through it. When preparing for this day, another quote came to mind, perhaps not as applicable in my case, but slightly more profound. Happiness is neither virtue nor pleasure, nor this thing nor that, but simply growth. We are happy when we are growing. These words by William Butler Yeats illustrate my perception concerning much of my education. Yes, there have been moments of frustration, anguish, and what the heck did I get myself into? But these feelings were infrequent and fleeting when the construct of creating a personal profession was kept in mind. As long as I was growing, advancing myself, I could withstand any lecture, any project, and any Crest Neville crossword. Sorry, Chris. And now, in this culminating moment on this stage, that feeling is coming to fruition. But today is not the end. I know I've come a long way from singing Baby Beluga at my kindergarten graduation, but I can honestly say that stagnancy is my greatest fear. Maybe it stems from my growing up on a farm, but I will forever equate that word with the tepid smell of standing water in summertime. It does not smell good. So, it's great sentiment for a speech, I know, but it's the absence of a current to propel us forward is what will constrain our ability to promote and perpetuate excellence. This is a celebration of students of the health profession. If we are stagnant, complacent in our societal duty to mitigate ailments and advance well-being, what's that say for society? I, for one, did not complete 7 years of college to end up a robot, and as cool as it sounds, I don't think my patients want that either. So before we hem and haw about the constraints that are placed on us, the rules, the regulations, the red tape, maybe we should consider the constraints we place on ourselves. Maybe here today, we should determine the litmus of our own excellence. Will it be the number of figures on our paycheck, the letters after our name? Or will it be the relationships that we create, the knowing that we've given each patient or client thoughtful, effective care, or even just battling mediocrity? I believe that we can always be better. Perfection is impossible, but progression is not. Now, if this is church, my grandfather would look at his clock or look at his watch and then shut his eyes. So I'll close the speech, but I'm going to do it selfishly. I would like to thank everyone who has gotten me this far, the college, and also my faculty. They've taught me that nothing's black and white and to be comfortable with the gray. All of my clinical instructors who showed me the gray, and all the pseudo parents that put up with me as I ranted about the gray during clinic. I would like to thank my peers. From the moment we had to strip down for soft tissue, I knew I'd get to know you probably too well, and I was pretty right, and it's been interesting. Lastly, I would like to thank all of the families that are here. Going to school to be a health professional is hard, but I'm sure supporting us through exams, tough patients, and hectic schedules is often more difficult because they also have to hear about it. So for this, I would like to thank my family, mom and dad, all of my brothers and sisters, Isaac, who's 5 and is sitting through this, poor kid. So thank you, and congratulations to the class of 2012.
Respiratory therapist, a medical biotechnology person, and a doctor of physical therapy. Could I ask each of the 3 to please stand up one more time, and congratulations for your outstanding performance. Thank you very much. I am pleased to introduce today our distinguished guest speaker. Our guest speaker is someone that I've known since I came to Upstate in 1995 and is truly one of the forces on our campus and one person that I am very, very proud to have been able to work at least closely to over my career here. I'm pleased to introduce Dr. Patricia Joy Newman, MD. Dr. Newman has forged a national and international reputation as a surgeon, an educator, and an advocate for women's health services. She was instrumental in furthering the professional advancement of women surgeons, advancing the surgical education standards for medical students, residents, and surgeons, and advocating for and creating women's health services. Dr. Newman brings about significant social change and equality of opportunity for women in the profession of surgery. She was described as a, quote, an iconic figure, our most tireless advocate for gender equity, unquote. For her leadership, vision, and service, she is called a rocket that has propelled us mightily throughout her distinguished career. Dr. Newman is the Lloyd S. Rogers Professor of Surgery, Emeritus, SUNY Distinguished Service Professor, SUNY Distinguished Teaching Professor at Upstate Medical University, and she launched her career here at Upstate, where she graduated in 1970, followed by her residency in surgery at University Hospital. At that time, she was the hospital's first female surgery intern and then became the region's first woman surgeon. Other firsts followed, including being the first woman to serve on the American Medical Association Council of Scientific Affairs, the first woman chair of the American Board of Surgery, and founder of the Association of Women Surgeons, which now has more than 3,000 members. She has served on the educational committees of 4 national medical societies, was the founding member of the Association of Surgical Education, conducted public and professional education for the American Cancer Society, and directed the surgical clerkships of medical students for 15 years. She developed and continues to contribute to the educational modules for the American College of Surgeons that are now being used by more than half of the surgery interns in the United States and Canada. Dr. Newman founded and ran the Comprehensive Breast Care Clinic at Upstate, making it possible for patients to receive rapid diagnosis and treatment for a range of conditions, including cancer. Beloved by her patients, she has been listed in the book of Best Doctors in America, a peer survey that captures the top 5% of American physicians. In 2009, Upstate created the first endowed chair for a woman, the Patricia J. Newman, MD, Chair of Surgery, in honor of her life's work and outstanding dedication. She is a recipient of numerous awards, and most recent being honored with the International Society of Surgery Prize of 2011. Dr. Newman received her Bachelor of Arts degree at the University of Rochester before she came to Upstate. I, like so many others, have had some very dear and close friends that have been patients of Dr. Newman, and they cannot stop talking about what a quality person Dr. Newman is, both as a physician and as a human being. Dr. Patricia Newman.
Thank you, Dr. Bonner, for that very generous introduction. I kind of wish I maybe hadn't done so much and you wouldn't have been tortured to have to sit here quite so long and listen. but anyway, President Smith, Dean Bonner, graduates, faculty, family, and friends, thank you for the privilege of participating in this special day. And it actually is quite amazing to me to see the number of professional disciplines and the number of graduates and the number of degrees that are being granted today. Because when I came here, there wasn't a College of Health Professions. And actually, over the last 35 years or so, I've watched the College of Health Professions evolve. Many of the leaders that are being recognized today in the awards that are given, Jean Lang, Dr. Bernard Henry, were very close friends of mine. And so were many of the other pioneers, Betty Martin, Carl Weisalis, Janina Casper, to mention just a few. And the current program and department chairs were many of the original students who were brave enough to enter new disciplines with uncharted courses, not knowing exactly where they would go. And now, as they are department chairs, they continue to strive to improve and expand their discipline. I have watched as they and others have transformed what was considered a service into a profession. I watched as voids in healthcare were filled by new professional disciplines. When I began medical school, there were no ventilators, not to mention respiratory therapists. People who had ventilatory insufficiency, even transiently, might well die. Now, there are so many ways that these patients can be treated because of the discipline of respiratory therapy and the quality of care that these professionals give, that it's hardly unheard of. It's almost unheard of to hear that somebody will die of respiratory insufficiency. And there are now so many special areas of expertise. It's really incredible in a good way. The development of the health professions has made an enormous difference in the care of patients. As with any new field, there are enormous opportunities for innovation. Our students and our graduates have a greater opportunity to make a difference in healthcare than any other group of professionals. They can eradicate ventilator-acquired pneumonia. They can teach us to prevent ergonomic injuries in healthcare workers. They can develop effective algorithms for laboratory testing to reduce costs. And they can help us save lives in many new ways. For example, the role of extracorporeal support by the perfusionist is expanding rapidly to allow continued life for those who would die waiting for curative treatments. Even Jean Lang, who started that school, would find it hard to believe. Without speech pathologists, many would not choose to live or would live in isolation. As radiotherapy is used more extensively as adjuvant as well as curative therapy, the radiotherapy technologist will be in ever greater demand and will be called upon to lead to discover better prevention or treatment of radiotherapy-associated symptoms. I could really go on forever, for each of these disciplines is really exciting and creating just so many changes to the quality of patient care. But that would take a long, long time. Actually, a while ago, a commencement speaker spoke for an hour, and I promise you I won't do that. Sometimes you will get discouraged by what you cannot do as a health professional. Caring for people frequently during the most difficult periods of their lives is an inordinate privilege, but it can also be draining. Make sure to always empathize with your patients, always treat patients with respect, always allow them to preserve their dignity, and you will be immensely satisfied. The day-to-day work of medicine is sometimes very challenging and heartbreaking. It is easy to lose sight of your ideals or become discouraged. I encourage you to have good friends outside of medicine. They help you keep perspective. Spend time with your family. They will always center you and remind you of your basic worth. Do work you enjoy. There can be no greater pleasure than going to work each day, knowing that you will make a difference. And if you find things are not going well for you, have the courage to reassess what you are doing and change it, because there are just an enormous number of possibilities that you can pursue. I believe that your professions are still in their infancy and will grow tremendously into all aspects of patient care and society. You have so much to offer the well in keeping them healthy, to prevent disease and to avoid disease. So keep your eyes open to new ways you can use your knowledge and skills. Continue the pioneering efforts that have moved your profession so far. I admire and applaud you on what you have accomplished in such a short time. And I wish each of you a successful and rewarding career. Thank you.
It's now my pleasure to begin the award ceremony, and the first person that will be giving the awards will be Bruce Searles, Department of Cardiovascular Perfusion. Would you please come to the left podium, and all speakers will follow Bruce. Dr. Smith and I will be at the very front of the table and greet our award winners. Donna Bavanese, our Associate Director of Admissions, will help with the process. So, Donna, please come forward too.
Every year I'm reminded with how lucky I am that I get to start the most fun part of the ceremony. This is the awards ceremony. So without further ado, I would like to announce the award recipient for the Jean Lang Excellence in Professionalism Award. This award is given to the graduate of the student of the Department of Cardiovascular Perfusion who exemplifies the consummate cardiovascular perfusion professional. This award this year is presented to Mayapan Aranchalam. Dr. Newman talked about Jean Lang. She was the founder of our program, and she was the first female program director in the nation. The next award goes to the Department of Cardiovascular Perfusion's Clinical Excellence Award. This is given to the graduating student with the highest mastery of clinical skills as determined by a panel of clinical instructors. This year will Javed Aswani please come forward to accept his award. The department has one more award. It is the Department of Cardiovascular Perfusion Academic Excellence Award. It is given to the graduating student with the highest GPA above 3.49. This year is Tyler Kelting. If you'd like him to please come forward and accept his award. Now, Mr. Kelting is going to remain on stage. He has also received the Lawrence Scientific Presentation Award. This award was given by the American Academy of Cardiovascular Perfusion for a research project that he did above and beyond his curriculum. His project was titled Air Bubble Detector Placement on the Cardiopulmonary Bypass Circuit, a cross-sectional analysis of the practice of certified clinical perfusionists. This award was given to Tyler because he had the most outstanding student presentation on a topic of original research that brings something new to the field of cardiovascular perfusion. Mr. Kelting's study was peer-reviewed and has been accepted for publication in the journal titled Perfusion. Now, Tyler, don't go anywhere. It's also my honor and privilege to announce the award for John Bernard Henry Endowed Scholarship. This scholarship was established in 1994 at Dr. Henry's request and provided a cash scholarship for a student or students from each college, each of our 4 colleges. And those colleges are graduate studies, health professions, medicine, and nursing. And the award is based on their students' outstanding paper, project, or other exceptional accomplishment above and beyond the requirements of their academic program in one of the following areas: blood banking, transfusion medicine, health policy, biomedical ethics, experimental biology, disease prevention, health promotion, biomedical basis of human function, health-related technologies, or medical informatics. And each year, the dean appoints a committee to review all the materials submitted by students in their respective colleges. The competition is open to all matriculated students in good standing, and the scholarship is awarded to students whose paper or project or accomplishment is judged by the committee to be the best among those submitted in the college. I'm pleased to announce that Tyler Kelting is the student from our Department of Cardiovascular Perfusion. Tyler received that award for his previously mentioned air bubble study, and it's worth noting that his faculty advisor for this project was Edward Darling, who is associate professor in our department. It's now my pleasure to introduce Susan Graham to give a few more awards to very deserving students.
It's my pleasure to announce the award for the American Society for Clinical Pathology Scholarship. This national award is presented to a student who has shown outstanding academic achievement, strong leadership in the field, and active community service. Brittany Thomas, please come forward to accept your award and remain on stage. The Rinker Robinson Memorial Scholarship is given to a graduating senior who has demonstrated not only academic ability, but also those qualities of leadership, community involvement, and professionalism. Brittany Thomas is also the recipient of this award. Now I'd like to introduce David Clementi, Chair of the Department of Medical Imaging Sciences.
It's my pleasure to award the Medical Imaging Sciences Department Academic Outstanding Achievement Award. This is presented to the student in the graduating class with the overall highest academic average. This year, we have 2 recipients, Mira Modai and Benjamin Marchuk. Please come forward to accept your awards. like to introduce Ms. Sandra Vanis, Chair of the Department of Physician Assistant Studies.
The Department of Physician Assistant Studies Academic Achievement Award is presented to the student in the graduating class with outstanding academic ability demonstrated by our outstanding GPA. Will Sarah Hand please come forward to accept your award? The Department of PA Studies Outstanding Clinical Award is presented to the student who demonstrates the commitment, knowledge, growth, and professional skills reflective of the physician assistant profession. Patrick Shannon, please come forward to accept your award. And now I'd like to introduce Dr. Susan Miller, Chair of the Department of Physical Therapy Education.
Thank you. The Department of Physical Therapy Education Professional Participation Award is presented to graduating students who have demonstrated involvement and commitment to professional growth and development in physical therapy. Will Dr. Maureen Mancuso come forward to accept your award? The Department of Physical Therapy Education Academic Achievement Award is presented to graduating students in recognition of academic excellence. This year we have two. Would Stephanie Monroe and Priya Prince please come forward to receive your award? I should have said Dr. Stephanie Monroe and Dr. Priya Prince. The Department of Physical Therapy Education Clinical Excellence Award is presented to a graduating student who embodies the professional and personal attributes valued by the profession of physical therapy. Will Dr. Mariana Bartonacek please come forward to receive your award? We have two awards that were previously awarded, and I'd like to recognize those students. The first is the NYPTA Student Participation Award, presented to one student of the graduating class who, as a member of the professional association, participated in activities on a national chapter or district level, participated in extracurricular activities relating to the profession, and demonstrated leadership qualities. Stephanie Monroe, will you please stand to be recognized? The Michael P. Bohm Physical Therapy Practice Scholarship is awarded to a graduating physical therapy student who demonstrates academic and clinical excellence with a strong commitment to professional practice. Will Dr. Andrea Legg please stand to be recognized? And now I would like to introduce Joan O'Brien, Chair of the Department of Radiation Therapy.
The Radiation Therapy Department Outstanding Academic Achievement Award is presented to a student in the graduating class with the highest overall academic average. This year, a Bachelor of Science student achieved this honor. She also just this past week took her national board exams and earned the highest score in the 45-year history of our program. Jenny Rapley, please come forward to accept your award. I'd now like to introduce Mr. Joseph Sorbello, Chair of the Department of Respiratory Therapy.
Thank you, Joan. The Department of Respiratory Therapy Clinical Practice Award is given by the faculty to a graduating student who has shown remarkable motivation, knowledge, skill, and sensitivity to the needs of their patients. Joshua Smith, please come forward to accept your award. The Department of Respiratory Therapy Education Outstanding Student Award is presented to the graduating student who has demonstrated overall academic excellence and has achieved the highest grade point average in the graduating class. Astrid Henry, please come forward to accept your award. The Department of Respiratory Therapy Community Service Award is given by the faculty to a graduating student who has shown remarkable motivation, knowledge, skill, and sensitivity to the needs of their patients. Brandon Boyer, please come forward to accept your award. The New York State Society for Respiratory Care, Central New York Chapter, Academic Excellence Award, and the Distinguished Student Award are presented to graduating students with the highest record of academic achievement. Ann Schaaf is the recipient of the Academic Excellence Award, and Astrid Henry, the recipient of the Distinguished Student Award. Ann and Astrid, please stand and be recognized. I am pleased to recognize 7 inductees to Lambda Beta, the National Honor Society for Respiratory Therapists, alumni, and faculty. Membership is limited to the top 25% of each graduating class achieving high grades and excellence. The purpose of this society is to promote, recognize, and honor scholarship. Will the following graduates please stand to be recognized? Nazneen Akhtar, Stephanie Canali, Astrid Henry, Jennifer Reese, Ann Schaaf, and Joshua Smith. I now have the pleasure of introducing Dr. Gary Brooks, Associate Professor and Chair, Research Advisement Committee.
Today, I'm pleased to announce the recipients of the College of Health Professions Student Research Award. The College of Health Professions Research Advisement Committee recognizes the following outstanding contributions to Student Research Day, which was February 29th, 2012. Priya Prince, Doctor of Physical Therapy, Sarah Height, Master of Science in Medical Technology, and Trevor Farnsworth, Master of Science in Physician Assistant Studies. Please come forward to accept your awards. Dr. Prince's podium presentation is entitled Exploration of the Fibularis Longus and Brevis during gait using functional electrical stimulation. Ms. Height's poster presentation is titled Effects of Malaria and Epstein-Barr Virus on Infant Immunity to Vaccines, and Mr. Farnsworth's poster presentation is titled Diagnosis and Treatment of Gallbladder Torsion in a 6-year-old. And now it's my pleasure to reintroduce Joan O'Brien, who's also Associate Dean for the College of Health Professions.
The recipient of the Dean's Outstanding Student Award has been nominated by the faculty and selected by the Dean of the College as combining academic excellence and outstanding campus professional community activities while matriculated in a College of Health Professions program. Maipan Aranchalan, Bachelor of Science in the Department of Cardiovascular Perfusion, please come forward to accept your award.
At the conclusion of the ceremony, I really want to thank the many people that put everything together. But I'd especially like to point out Sharon Heward and her staff, who have been here since, I believe, 7:30 this morning. I would like to thank Dr. Julie White in the Office of Student Affairs, whose staff has also been here all day since 7:30 this morning. I want to thank Physical Plant, who have helped put everything together. Susan Burke, who is in the College of Health Professions Dean's Office, who has been here this afternoon to help with this. And I have special thanks to Diane Conklin, the College of Health Professions Chief of Staff, who has put together the entire stage directions and everything else. So thank you very much for all that you have done. This concludes the presentation of awards program, and the congratulations to our graduates and to our families. I look forward to seeing all of you. We have a program up in the CAB building on campus following this ceremony. When the students leave, they will go out the back door, so they will meet the parents as outside of the auditorium. So go on outside and the students will come up to you. And if you would please wait, because the procession will walk out. Thank you very much, class 2012.
Thank you.